Sabrina. Just before we start, I'm trying to allow like few more minutes for us to have more attendees join the meeting. But while we wait for them, kindly use the Q&A feature of the of the webinar to try to introduce yourself, tell us your name, where you are joining from. If you could also maybe drop your email address. We will be using the Q&A for both the chat function and also the question and answer for the webinar. Um, Thank you. So we'll just give maybe 3 or 5 additional more minutes to have many people joining so we don't have to recap. In the meantime, also, we like for if you are joining in, maybe you'd like to for people who would like to listen in another language to join. So today we will have uh 3 speaker. We have lineup of 3 speakers for today's webinar. The first speaker will be presenting in French. So if you would like to listen in English as she starts our presentation, please kindly check the more feature of your uh, what's it called now? Of the add-ins in your Zoom feature. You see a place with like 3 buttons that have a more. If you click on that, you would see an interpretation feature where you could select the language of your preference. Okay, thank you. Just yes, we have quite a number of people on the call, but I'll just give 2 additional more minutes. Thank you. Have any struggle hearing us or something, kindly use the question and answer session in case you are not able to access anything um, from the presentation. So to start today, I would like to let me share just give a background to I don't know if you can see my slide. Sorry, that's what I said. So for I want to give a background to the maiden edition of the webinar series. So we started in May with an African-wide webinar series where we try to provide education on on health and nutrition related issues to people so that we are able to give out correct information and try to correct any form of misinformation that people may have on health and nutrition related issue. So we since it's African wide, we try to uh, bring together different speakers across the Africa continent. So we have speakers from Ghana, from Mali, and from Nigeria. So today, again, in celebration of the exclusive breastfeeding week, um, I, s- the focus of our webinar today is on community culture and policy, charting sustainable breastfeeding support in Africa. And as I mentioned earlier, for those who joined in on time, we have 3 speakers who will help us explore this topic today. We have Dr. Rabia from Morocco, we have Aderonke Alabi from Nigeria, and we have Valerie Sang from Kenya. So I would now like to introduce the first speaker for today, who, as I mentioned, and as I mentioned, will present in French, and she, Dr. Sorry, please. She will present in French, so I need you to drop in the chat to be sure that you are able to listen in your language, especially for those for our audience who are French speakers, so that you are sure that you can listen in the French version. So Dr. Robert is a physician, as I mentioned earlier, based in Morocco. She has background in also human nutrition, where she did a PhD on on breastfeeding related issue. I would now like to introduce Dr. Rabbi to please start to prepare for our presentation. Even as she starts up us today for this great webinar series. She's a PhD holder in human nutrition and health with extensive experience in public health, clinical nutrition, and maternal and child health. She currently serves as the Dean of the Faculty of Public Health Sciences in Mondiapolis University in Casablanca, Morocco. And as I mentioned, our doctoral research is focused on evaluating breastfeeding practices and body composition in lactating women. I'll skip the method where she used. She has extensive background both in academia, clinical, and community-based initiative. So I would now like to invite Dr. Robert to please proceed with our presentation.
Bonjour tout le monde. Merci pour l'invitation et merci pour l'organisation de ce webinaire. Et sans plus tarder, je vais commencer ma présentation. Je vais partager avec vous ma présentation. Voilà, je pense que c'est bon.
Yes.
Yes.
Oui.
C'est bon? Oui. Ok, très bien. Donc, tout d'abord, comme j'ai dit, je vous remercie pour l'organisation de cette journée très intéressante. On ne cesse d'encourager les femmes à allaiter, mais il y a toujours des entraves et c'est l'intérêt d'organiser ce genre de journée pour pouvoir partager nos expériences. Nous avons presque les mêmes problèmes en Afrique et nous avons besoin de partager nos expériences pour pouvoir gagner plus de temps et permettre un allaitement, une promotion, comme vous l'avez dit, durable. Donc, la première chose que je vais, excusez-moi, je vais juste me débarrasser un petit peu de ce, parce qu'il y a quelque chose qui me cache. Très bien, voilà. Alors, les normes culturelles qui sont dont nous vivons, parfois, sont contradictoires avec ce que nous allons promouvoir. Donc, le premier constat est que l'allaitement maternel est une pratique culturellement valorisée dans nos pays. Mais malheureusement, certaines normes culturelles vont entraver la pratique de l'allaitement maternel. Par exemple, nous savons que l'OMS conseille ou donne définition ou elle recommande l'allaitement maternel exclusif de la naissance, dans l'heure qui suit la naissance, jusqu'à l'âge de 6 mois, et que le lait maternel, c'est-à-dire que la maman ne doit donner que le lait maternel jusqu'à l'âge de 6 mois.
Nous savons
Même
que
l'eau.
maternelle,
Donc, comme j'ai dit, l'OMS recommande l'allaitement maternel.
dans nos pays africains, in many African communities, including in Morocco, breastfeeding is highly valued for its symbolic and cultural significance. However, certain traditional practices may contradict scientific recommendations. For example, early introduction of water, herbal teas, or solid food before 6 months. The belief that colostrum also is dirty and useless in some cultural and rural region is very spread. So this kind of belief can compromise exclusive breastfeeding that WHO is advised us to promote. This first observation is that breastfeeding is a culturally valued practices in our African society.
à la consommation et
In
éduquer.
addition,
Et ça, c'est des
urbanization distances
pratiques
mothers
qui sont
from the
aussi
family environment and
préjudiciables
often leads to
aujourd'hui
an
avec la
early return to
normalisation.
work, typically without adequate
Deuxièmement,
conditions.
l'urbanisation
Aggressive
va
marketing of formula milk
mettre
also
en opposition
weak
l'égalité
maternity
de
leave
l'allaitement
policies and
maternel
limited
et féminin
professional
et
support
aussi
further
des
exacerbates these
sociaux,
challenges.
c'est-à-dire
Finally,
que
many
le fait
mothers feel
d'être
isolated,
au milieu de
poorly
famille
advised, and
plus
misunderstood,
le fait
misunderstood
de travailler hors du
throughout the
foyer,
breastfeeding
ça va
journey.
la séparer un peu et de la famille et du bébé. Ce qui va, quand pour une femme allaitante, va rendre la mission d'allaiter au sein plus difficile et
With
peut-être même
urbanization and lifestyle changing
difficile pour
in
les
our
femmes
decades,
dans
we notice
le
that
monde du travail
women are
et pour
increasingly
les femmes
integrated into the labor market,
qui ne
actually.
sont pas formées
Mother-child separation
sur
become
l'allaitement pour
more frequent
appréhender
and
l'allaitement
early,
maternel
and the lack of
et
breastfeeding-friendly space
d'imiter
in
de
public
l'allaitement
areas
maternement
in
et
workplace pose a major
de
challenge.
donner au bébé.
This leads to a
Donc,
decrease in both the duration and frequency of
désormais,
breastfeeding, especially in
donc, c'est
urban
des obstacles
settings.
qui vont entraver la pratique de l'allaitement maternel. La troisième chose, et le point aussi très
Uh,
important, c'est cette
the
pression commerciale
crucial point also
de
is the
d'installer
commercial
une
pressure from
industrie
breast
pour
milk
substituer le
substitutes.
lait maternel.
There is the
Une
aggressive marketing of
stratégie
infant
politique
formula that
très agressive
often
contre
appear
une
in
partie
contradiction with
très
the
réduite
WHO
qui
International
sont
Code
même
of Marketing
allés
of
à
Breast Milk
former et à
Substitutes,
cibler
and that is
les
remain a
femmes,
major
les
concern.
infirmiers, les sages-femmes,
Health professionals
pour
also may
pouvoir des
influence
substituts du lait
mother
de telle
decision to
sorte même que
breastfeed
dès la
kids
naissance,
by
dans les structures
giving by
médicales dans
gift
lesquelles ce
screening
bébé
section of
est
free
élevé,
sample.
et
Some families
qu'auparavant
also,
on donnait
especially in
la
urban areas,
priorité
perceive
aux
formula
enfants de
as
leurs
more
frères
modern and more
plutôt que le
nutritious.
lait
This
artificiel ou
undermines mothers'
substitut,
confidence in the
le
ability to
soit de
breastfeed
lait
their
à la
kids.
naissance ou de lait à la mort.
Despite the existence of the whole code, some companies still target
L'Union
health
européenne,
professionals or
l'OMS,
mothers with free
mettent en
sample
tapis l'accouchement. Souvent, les mamans
and message
sont privées
that
du
promote
droit
formula
d'allaiter
substitute.
le lait
This creates a sense of
de leur
insecurity
bébé jusqu'à ce qu'on
among
obtienne
some mothers and
le
weakens
bébé.
the
Donc ça, c'est
confidence in the
une
ability
stratégie
to
marketing,
breastfeed.
malheureusement, qui sévit dans nos pays, même s'il y a un code pour cela. Il y a aussi un souci,
There
c'est
is
que
also the
il y a
weakness
une
of
faiblesse
maternity
dans la
protection
protection de
policy.
la maternité.
In Morocco, for example, although
Dans
the
le monde du
legal
travail,
maternity leaves of
elle a
14 weeks
changé de
that
maternité.
exist,
Le congé de
its
maternité
implementation remain
comporte
unequal,
14 semaines.
especially in the
Malheureusement, ces
informal
14
sector.
semaines
Few
commencent
companies
déjà
provide
en
breastfeeding-friendly
début du deuxième
spaces
mois, même
or
avant.
allow flexible working hours.
Et souvent,
The
les
lack
femmes, elles
also
sont
of
retardées
social
pour déposer
protection for
la
self-employed
déclaration de
or
maternité.
agricultural workers limits
Mais
the
ce
ability to
n'est pas
continue
suffisant.
breastfeeding.
Et même si
Uh,
elles ne sont
Without
pas
supports,
complètes,
structural
ce sont à
supports,
peine
breastfeeding becomes very
du
difficult
travail informel
when you
qui va
want to
augmenter. Donc,
restart
ce
and you
système de
want to go back to
maternité
work.
doit être revu, surtout dans
We
la
need to
société
without the
occidentale.
reinforcement or properly
Et
enforced
puis,
legal framework,
chaque
it's
entreprise
become very
en
difficult for
Europe
mothers to
sont
continue breastfeeding
habilitées
when
à ce que
working.
la maman puisse donner le sein avec toute dignité ou extraire son sein, son lait plutôt, excusez-moi, le lait. Normalement, dans les pays scandinaves où on a 99% de taux d'allaitement maternel, c'est grâce d'abord à au congé de maternité, le congé de paternité et l'aménagement des espaces de travail qui vont faire que la maman peut allaiter ou tirer le lait pour le garder à son retour, parce que ce qui est important, c'est le lait maternel, pas obligatoirement le sein. Alors, le manque de soutien communautaire et professionnel, ça
At
aussi,
the
c'est un point
community level and also in the professional environment, there is a lack of support. Many mothers do not have
à
access to
donner des
appropriate
conseils
advice,
adaptés
especially in the
aux
postpartum
femmes
period.
et même
There is also
de les préparer à
limited
l'allaitement maternel
postnatal
et à
follow-up, and
la
health
prise
professionals
en
are
charge de
not
l'allaitement
always
maternel qui
trained to
prépare
listen
avant.
or to
Et
provide compassionate
on doit
breastfeeding support.
accompagner les femmes parce que pendant
As a result,
l'allaitement
mother may
maternel,
feel
ces
judged,
femmes,
alone,
elles ont
or
des questions à
poorly
poser.
advised.
Elles auront toujours des questions à poser. Et malheureusement, quand elles sont
Mother
entourées
always needs
de
to ask
familles,
questions
de leur
during
famille,
the whole pregnancy
sur
process and
les
also when they give
croyances
birth. So,
culturelles, sont
professional
très
health
influencées,
agents
alors que le
must be
personnel
very
médical et
skilled
paramédical ne sont
to
pas
answer
formés aux
and
bases
support them during
en
that
matière
time.
d'allaitement maternel et d'accompagnement des femmes pendant cette période-là. Alors maintenant, il y a des choses quand même qui ont fonctionné au Maroc et que je veux aujourd'hui partager avec vous parce que je vais aussi écouter les autres intervenants et je vais prendre de vos
There are also
expériences et
some
finalement mutualiser toutes ces expériences
good
pour que l'on
experience
applique et
in
qu'on
Morocco.
puisse
That's very work.
profiter de
Uh,
leur application. Alors, les
to
leviers
support breastfeeding,
pour
Morocco has
permettre de
implemented
réussir le
several
breastfeeding au Maroc
multi-sectoral
sont de nombreux.
strategies that
On va
have led
citer
to significant
les
progress in
socialismes que je
promoting and
viens de
protecting
citer.
breastfeeding. Here
Le
are
premier,
four
c'est
keys
l'implication
levels
des
that
communautés.
have proven effective
Donc, ce
and
qui
would
est
be
ici
successful.
intéressant, c'est d'impliquer la santé communautaire. C'est cette santé qui est à
The
proximité
first
d'elles
one was to engage in
et
local
qui est
communities,
écoutée
involve
par les familles.
community health
Les
workers
acteurs
and
traditionnels,
traditional birth
les leaders
attendants,
religieux
and
essayent
even
de
religious
pouvoir
leaders
intégrer
has
des
helped
messages de promotion
ensure
de
breastfeeding
pratiques
promotion
locales.
message in local practices. There
Par
is also
exemple,
a pilot initiative
on a
that have shown that community
dans
involvement
les mosquées des
facilitate
endroits
behavior change,
où
especially when
il y a beaucoup
traditional
de
knowledge
communautés.
is
Mais pour cela,
valued
il faut que
alongside science-based
les
message.
formateurs
Example,
soient bien formés
organizing
pour délivrer
educational
les meilleurs messages.
talks in mosque,
Donc,
rural
les
health
initiatives
centers,
religieuses
and
comme
or women's
celle de
association.
l'adhésion communautaire
Social
facilitent le
acceptability
changement de
increase
comportement.
when we
Et
work
puis,
with
quand
communities,
c'est
not against the
valorisé
cultural
euh, par,
representation.
euh, par les
These
savoirs traditionnels
action took place in
et
familiar and trust settings like
les
mosque,
messages
rural health
euh,
sectors,
sont de
and women
sensibilisation
associations. And is
maîtrisés
approach
pour
that
les
this
bons
approach made
personnes
it
qui sont
possible to
écoutés et qui sont
build
respectés
stronger
par la
cultural
communauté.
ownership and support for breastfeeding.
On l'a dit tout à l'heure, le personnel n'a pas
As
assez de
is said
formation, mais
before,
justement,
Morocco
les
has
autorités
progressively
doivent
integrated
axer sur
breastfeeding
la
training
formation
into
du
the
personnel.
curricula of
Moi-même,
midwifery,
étant médecin,
nursing, and medical schools.
dans ma formation initiale, je ne savais rien sur
That
l'allaitement
was
maternel.
missed
Je ne
before
savais
a
rien
few
sur
years,
les questions de menstruation et puerpériode.
a
Donc,
few
comme
years
je dis,
ago,
je n'ai
but
pas
now is
commencé.
included in the
J'ai une
curricula.
petite
As myself,
expérience
I didn't
et
take
aussi
that kind of
pourquoi.
course, but
Ce sont
now
posées
I'm
par
happy
des
that it's included
difficultés
now.
auxquelles je n'avais
Several
pas
capacity
pensé.
building sections
Même
have
une
been
femme qui sait
organized with the support
pratiquer
of
la règle,
UNICEF,
est-ce qu'elle continue
the
d'allaiter ou pas? C'est une
IEAI,
question auquel
and
je n'avais
other
pas
partners
réponse jusqu'à
to
ce que j'ai trouvé
improve
une formation
breastfeeding counseling
continue
in the
sur ce
immediate
sujet.
postpartum period.
La formation du
There
personnel
is a
est
national
fondamentale
guidelines
et elle
that have been
est
developed
intégrée dans la formation
about the
initiale
infants and young
des
child
sages-femmes,
nutrition
des
guides
infirmiers
with a
et des
focus
médecins.
on
Ça,
breastfeeding
c'est quelque
techniques,
chose
managing
d'important. Et
challenge,
puis, il y a une autre chose,
and the importance of continuous
l'élaboration de
support.
guides
The training
médicaux
of health professionals
médicalisés,
ensure a
nutrition,
credible and compassionate
standardisés
source of support
pour que les
for
messages
mothers.
soient des messages, c'est les mêmes messages qui passent partout et qui passent à tout le monde. Tout le monde a les mêmes informations et les mêmes
The same
messages
information for about the promotion
il y
of
a lieu
breastfeeding are shared
dans le cadre
by the health
d'un
professional to
consensus, dans le
everyone.
cadre d'une stratégie et cette stratégie
There is
nationale
also a
est
structure, national
applicable
strategy framework that I want to show you
au
that
consensus
Morocco has
communautaire
adopted the
et
national nutrition strategy that includes
rempli
goals for exclusive breastfeeding aligned with global targets.
Donc
The
aussi,
SMART
des enquêtes ont
National
été faites
Survey
dans
and the
des pays
ENNS have
crédibles et
helped
des pays
document practices more accurately and
savoir
adjust
confirmés et de
public
pouvoir
policy based on
atteindre
regional
des
data.
objectifs réalistes
Breastfeeding
et
indicators
qui vont
have been
beaucoup
integrated also in the Ministry of
donc,
Health monitoring
il faut
dashboards.
avoir ce cadre
And
stratégique
we want to
national
thank
de
to
breastfeeding
SMART
qui
and
renforce
ENNS surveys that
développement
now
des
have
politiques
valuable
publiques.
data that allow policy to be
Les
adjusted
partenariats
at the regional
multilatéraux,
level.
c'est-à-dire que l'implication de tous, des organismes,
Uh,
d'abord des
a
institutions,
successful collaboration
de,
have been
de
established
telles,
with international
des
organizations
institutions
such as UNICEF, WHO,
comme le ministère
and
de la
others
Santé,
as well with Moroccan
ainsi
University and local
des organismes
NGOs
internationaux
also.
comme
This partnership have enabled to funding and apply research
les ONG.
such
Tout
as
ça, c'est
the study on body composition in breastfeeding women using isotopic technique.
beaucoup
They're also strengthening health system, training
d'inciter l'enfant
equipment, technical
à la
support,
promotion de l'allaitement maternel
advocacy for more
il y aura
ambitious public
aussi
policies, especially around
l'étude sur la
the implementation of the International
l'étude
Code
qui a
of
été
Marketing
faite et qui a
of
été
breast milk
publiée dans le
substitutes.
journal La
Alliance
Santé
between
publique.
researcher,
Donc,
policymaker, NGOs,
cette
and
étude
international
va venir
institutions
sortir
are
beaucoup
essential to amplify
d'informations
impact.
scientifiquement. Le renforcement du système de santé, le plaidoyer pour les politiques publiques. Donc tout ça, c'était des choses qui ont été réalisées grâce à ces partenariats multisectoriels. Donc, en résumé, ce qui a fonctionné au Maroc, c'est les interventions ancrées localement, les engagements forts des professionnels de santé, la volonté politique structurée et la coopération internationale. Ce sont quatre piliers, quatre actions ou quatre axes d'intervention qui ont permis d'avancer dans la promotion de l'allaitement maternel au
In
Maroc.
summary, what has
Donc,
worked in Morocco includes
il faut
locally
dire
grounded
que
intervention,
euh,
respectfully of
pour
cultural
que la
realities,
promotion de l'allaitement
uh,
maternel soit durable, équitable
strong
et
commitment
efficace,
from health
il
professionals
faut
who
que
are
ça
trained and
s'appuie sur une
engaged.
approche
Structural
intégrée
political
et
will supported
contextuelle.
by a clear strategic framework and
Or,
international
ça,
cooperation
c'est
to
un peu
foster
les
innovation and
recommandations parce qu'on est
evaluation.
encore loin de ce qui a été projeté
For recommendation for
comme
sustainable breastfeeding support in Africa, for breastfeeding promotion
objectif pour l'allaitement,
effort to
pour
be
atteindre les objectifs de l'allaitement
sustainable,
maternel.
equitable, and effective,
Donc,
it's essential to rely on
les
an integrated
les
and
recommandations de
contextualized
breastfeeding
approach
maternel doivent être
and culturally appropriate health education.
prendre en
Breastfeeding promotion
considération
message
vraiment
must take into
une
account local belief,
certaine
social
manière
norm, and
de
tradition.
culture
The goal
différente de
is
la
not to
culture
impose a biomedical
au
model,
Maroc. Et
but
puis,
to
mais au
co-construct
Maroc,
educational message
ce
that
qui,
resonate with
je parle du
communities.
Maroc, mais je peux parler aussi
Example, using
d'autres
local
régions.
language involve
C'est qu'au
community
Maroc,
leaders
on a plusieurs régions. Chaque
illustrating
région a ses
breastfeeding
spécificités.
benefits to
Comme
testimonies or local
l'importance, il y a des
metaphors.
régions encore au Maroc où enlever le foulard, c'est pas, c'est interdit, culturellement interdit. Il y a encore des régions, il y a des régions au Maroc où allaiter et il faut se cacher pour le faire. Même la
There is
femme,
still
elle est
in some region in my country that people are not allowed to remove
il
the
faut le respecter.
scar
C'est une
to breastfeed
spécificité qu'il faut
the baby
respecter.
is
Donc, il faut donner
not allowed.
le conseil,
So we still have a
on va
long
appliquer
way
un
to
conseil
change
du Maroc,
cultural things,
des
but we
régions, et
can
pour chaque
find
région, il faut que ça bien,
appropriate
bien
solution
adapté.
to help
Les
mothers, to
politiques
support
de
mothers
protection de
to
la maternité, c'est-à-dire de
breastfeeding.
revoir ce congé de maternité
For maternity
de 14
protection
semaines, mais
policies, we
aussi
have the
de
adoption of
revoir
laws
comment est-ce
guaranteeing
qu'on
at
peut
least
ménager
14 weeks of paid maternity
au lieu
leaves.
du travail
That is
des
very
deux enfants
essential.
pour que la
A
femme garde
workplace
ses
should be
enfants en même
required
temps
to
qu'elle
provide
puisse
safe
faire
and
son boulot.
dignified space
Et
for
la
breastfeeding
législation
or
doit être
expressing
claire,
needs.
elle doit être
There is
bien
also clear
appliquée contre les
legislation
pratiques
to curb
agressives
the
et
aggressive
surtout le
marketing
défi de
of breast milk
l'abandon, le point
substitutes.
noir
That is also
encore
crucial for
dans les
change.
cas chez nous au
Protecting
Maroc,
mother
en tous les
rights.
cas dans notre lutte, on n'arrive pas encore à,
Protecting mother rights
à
means
arrêter
protecting
ces
every
schémas
child's right to
agressifs
benefit from breast
agressifs
milk.
qui ciblent professionnels de la santé et pour lesquels nous n'avons toujours pas de solution. Et puis, le renforcement des capacités, comme on l'a dit tout à l'heure,
There is also
le personnel
capacity
paramédical,
building
c'est-à-dire
that
quelqu'un
should
qui est
be
bien
think
formé sur le
about
plan
that it is
scientifique,
essential
qui
to
va voir sur
train
des lacunes dans l'écoute
frontline
bilinguale
health
à la
workers, community
l'écoute de
volunteers, and peer
l'utéropathie, c'est-à-dire
educators
ceux qui
in
pourront, on va pas
compassionate
enseigner dans le
listening,
cursus
managing
des choses qu'on peut apprendre
breastfeeding
par cœur,
challenges,
comment gérer
continuous
les
postpartum
gestuels
support,
au niveau
simple educational
bilingual,
tools
comment
using
créer un
videos,
tonneau, savoir
infography,
symboliser.
leaflets
Il n'a plus
can be
fallu
provided to
savoir si l'enfant
support counseling
a assez
efforts.
pris de lait. Donc, tout ça, c'est des questions qui ne figurent pas dans la formation initiale, mais pour lesquelles il va falloir
And
faire
training and
réaliser des efforts.
empowering frontline
Et
worker
à
means
l'égard des
guarantee
outils
sustainable and trust
c'est-à-dire
local
les outils par
support.
lesquels nous passons des messages doivent s'améliorer. Des vidéos qui sont très explicites, faciles à comprendre par tout le monde et avec tous les dialectes de toutes les régions marocaines. L'approche multisectorielle, on en a
There
parlé
is
tout à l'heure, mais il va falloir
also a
renforcer
multistructural and integrated
une meilleure
approach,
coordination
and that means breastfeeding
entre
should not be just
les
viewed
autorités
as an
publiques locales
isolated
et
health
les
sector
partenaires
issue,
techniques
but as
pour
a cross-cutting priority. It is
travailler
essential to
correct
build
concernant
synergy with
la santé
nutrition
publique.
policies, girls
Donc,
education
je
program,
vais un peu récapituler tout ça.
women
Tout ça
economic empowerment
consiste en quatre
strategies.
piliers. Le premier pilier, comme on l'a dit, c'est l'écoute.
I summarize
L'écoute de
everything
notre
I
enfant.
said
Le
before in
discours
four
adapté
parts.
à la culture, au dialecte, aux croyances, il faut qu'il soit réalisé de manière
And the first one
adaptée,
is
de
the
manière
cultural sensitive health
la deuxième
education.
chose, c'est l'écoute
That's mean
maternelle
using
et paternelle,
uh,
c'est-à-dire
local language,
l'utéropathie,
translating health message
la
into
maladie
accessible cultural
au
framework,
niveau
and integrating positive cultural value around
dire
motherhood.
les femmes qui
Community
souffrent
actors such as
des
traditional birth
réverbérations,
attendants, religious leaders,
assurer
or
la protection
peer
sociale
mothers can
pour tout le
be
monde,
powerful
que
drivers of
la femme,
behavior
quand elle
change.
est dans le travail, par
And
exemple,
strengthening social
elle arrive du
support for
travail, il
breastfeeding
faut
by
qu'elle
valuing local knowledge while delivering
garde
message
un
grounded in
revenu
specific evidence.
aussi.
The second one is protection of policies. That
La,
means a
la
supportive environment
protection
that
des
is
suicides,
essential to enable mother to
protection
continue
de vue
breastfeeding
de
after
tous les
birth.
impliqués.
To
Le troisième point, c'est le renforcement des capacités par le renforcement de l'écoute active,
The third one will be the
l'entretien
capacity building that for
motivationnel
mothers
de
to
toutes
successfully
ces
breastfeed,
méthodes
she
pédagogiques
must be supported by a
qui
network
va
of
utiliser
trained
les
professionals
méthodes,
and peer
méthodes
educators. That is essential to train health
des politiques
workers,
publiques
community volunteers, and
qui
peer
sont d'un
for
tout
breastfeeding best practices, prevention and management of challenges,
des
respectful
actions
postnatal support.
intégrées, c'est-à-dire que
And the
tout n'est pas
fourth
facile, il n'y a pas un
aspect is the
système que
multistructural
ça ne va
action.
pas se
That's
mettre à fait tout seul, ça va
is the
s'articuler.
breastfeeding lies on
Et
at the intersection of multi-sector
c'est le ministère
health, education, employment, gender, and agriculture. And
c'est
its
les
promotion must be
associations,
integrated
c'est les
into national
ONG, tout le
nutrition
monde est impliqué
policies,
dans la promotion
maternal and child health program, gender
de la santé
equality
publique,
plans,
de la
and
santé du jeune enfant,
educational
de la
campaign
santé de notre
in schools
population.
and media.
Notamment,
That's the coordination between ministry,
lorsque
NGOs,
nous,
and local authority, and as well international
alors
partners.
je
It's
vais
essential
finir ma
to
présentation
maximize
en
synergy
rappelant que
and place
également
breastfeeding at the heart of sustainable development and women
assurer c'est
empowerment
pas seulement
strategies.
du lait, c'est pas seulement le nourrir,
A
mais
mother's
aussi
breast
elle
is the
doit être
child first
le
school.
premier
This
élément
powerful African power proverb
déterminant pour
reminds us that
de
breastfeeding is not just
un bon développement.
nourishment, it's
C'est le
a
premier
child
pas,
first connection with
c'est
life,
la première
love,
étape.
and
Et
learning.
puis, j'ai
It's
mis
where
aussi ce
protection,
petit
education,
mot
and
qui,
emotional bonding
qui me tient à
begin.
cœur.
Supporting
Retrouver dans d'autres
breastfeeding
pays
means value
même
this
la
ancestral
pratique
knowledge and giving every child
du
the
sport
best possible
n'empêche pas
start
l'allaitement
in
maternel.
life.
Alors que chez nous, encore la culture qui peut empêcher, mais aussi, et ce qui est encore plus grave, le travail de la femme, l'indépendance de la femme financière l'empêche de donner le sein. C'est malheureux. Mais tout ceci, je veux dire que rien n'est impossible. Tout est possible en mettant la main dans la main on est tous impliqués, on est tous, et puis la preuve, c'est ce séminaire d'aujourd'hui qui montre que tout le monde est impliqué et tout le monde peut faire avancer et permettre une promotion durable de l'allaitement maternel. Sur ce, je vous remercie et je souhaite une excellente continuation pour ce séminaire.
Thanks.
Thank you so very much, Dr. Rabbi. That was really nice. I was taking notes very fast. So, and I like the way you brought the summary, highlighting the four areas really: the need for capacity building for health workers, the need to promote breastfeed, they need to support mothers, and also policies that support mothers to breastfeed, and also implementing multi-sectoral action. So thank you very much. Still to come, we have two speakers whom I would now like to introduce. The first person, Aderonke Alabi. Let me make an attempt to choose. So Aderonke Alabi is a public health nutritionist with 5 years of experience in project coordination and nutrition advocacy. She currently works with Global Alliance for Improved Nutrition on the Strengthening Nutrition in Priority Staples project, supporting initiatives that improve access to nutritious food and promote workplace nutrition, of course, including the advocacy for breastfeeding support across formal and informal settings in Nigeria. She's been able to engage with government and private sector for advocacy on workplace nutrition. You saw in earlier presentation where there was a gap in that in the Morocco context. So today, Aderonke will be leading us. She holds a bachelor's degree in human nutrition and dietetics and a master's in human nutrition from the University of Ibadan. She has previously worked on projects with Impact Nutrition Africa. So today, good afternoon. I would like to present to you Aderonke Alabi, who will talk about policy supporting breastfeeding in Nigeria from the nutrition sensitive and nutrition specific approaches. You're welcome, Aderonke. Good afternoon.
All right. Good afternoon. Good afternoon, everyone. Good to be here. My name is Catherine Kalabi once again, and I'll be taking you through discussions on policy supporting breastfeeding in Nigeria. That is the nutrition specific and the nutrition sensitive approaches. So let me just guide you through my slide. Okay. So I'm quite aware that the third speaker is going to give more background on the importance of breastfeeding, so I won't go into that. So I'll just dwell on the importance of having breastfeeding policies, why it matters either in the informal sector or the formal sectors. We know breastfeeding is quite both important to the mother and to the growing baby as well. It helps to reduce the infant sickness or mortality, and as well there are additional benefits for the mother. And its policies help to support exclusive breastfeeding. We know that WHO recommended exclusive breastfeeding from birth to 6 months, and then you continue breastfeeding with complementary food until 2 years of age. And in order to achieve this, in order to ensure that both women in the urban settlements, urban communities, rural communities, low-income communities, to ensure that they also imbibe this approach, also do this exclusive breastfeeding, we need policies that will guide them to ensure that they implement, and also processes. These policies will guide processes to also ensure that these things are put in place to ensure there's breastfeeding, exclusive breastfeeding rather. Then also these policies help empower women. We're quite aware that women have to balance work with taking care of their family, taking care of their baby, and then she doesn't have to choose between a career and then a child. So this policy will also guide to ensure that probably a place of work can have flexible working hours or breastfeeding breaks for her to go attend to a child, and also give her maternity leave to take care of a child before and then recuperate as well before getting back to work. And these policies also support gender equality in the workplace to ensure that they are not there's no discrimination for working mothers or breastfeeding mothers. So I'll move over to talk about the classification of breastfeeding policies. We have the nutrition-specific policies and we have the nutrition-sensitive policies. While the nutrition-specific policies directly target breastfeeding promotion and support, the nutrition-sensitive policies indirectly support the breastfeeding promotion and also through enabling environments. Like the nutrition-specific policies include the infant and young child feeding, that's IYCF policy, and then food and nutrition policy, which directly promotes ensuring that breastfeeding practices are implemented. Then nutrition sensitive policies, we have either labor laws, social protection laws or guidelines, then gender policies that are created around most likely work environment to support breastfeeding for breastfeeding mothers, for working mothers through structural, economic and social interventions that might be put in place to ensure things are comfortable for them to also incorporate these approaches. So I'll be speaking first with the nutrition specific policies. One of them is the national policy on infant and young child feeding we have in Nigeria. So this policy focused on ensuring that exclusive breastfeeding is promoted among the rural communities, the urban communities. Everyone that is a mother that is breastfeeding needs to ensure that their child is exclusively breastfed for the first 6 months of life with no fluid, drink, or water except medications prescribed by a medical doctor or a medical practitioner. Then they have to continue breastfeeding until 2 years of age with appropriate complementary feeding. We're quite aware that breast milk cannot cater to the nutritional needs of a child, of a baby beyond 6 months, which is why you accompanying complementary feeding rather with the breast milk. Then also this policy helps health workers, community workers, volunteers, staffs that NGOs and international NGOs work with. These guidelines help them to structure how to go about with behavioral change, especially with the rural communities, the low and medium income earning communities. There could be difficulties adjusting to these new approaches, new strategies, because they are quite used to the old method of doing things and they believe that years back a baby was giving water, so nothing should happen to the baby. It's good to give water. So in order to ensure that these practices are left behind and then they take on the new practices of ensuring exclusive breastfeeding is done, these guidelines help them with how to go about the behavioral change campaign, either it's a focus group discussion or whatever approach they might use to reach out to these mothers in these communities. Then I'll move to the second one, which is the National Policy on Food and Nutrition. This policy ensures that crèches are placed in workplaces, though in Nigeria, a lot of workplaces do not adhere to this, but there's still a lot of work that needs to be done, in a lot of follow-up by the government and government parastatal to ensure that both private sector and public sector, they implement this policy and also implementing the existing regulation of maternity leave. I know this has been mandated by every organization or company that has a female worker to ensure that when they need to go on maternity leave, they are given the time to go off work and they are not taking off their job. Though sometimes some companies might have issues with that, but they will have to find a replacement if possible, if they can't wait for her to return back to work, but she has to take a maternity leave. So this policy prioritizes protection and support for breastfeeding and then promotes baby-friendly hospital initiative. This BFHI has been ongoing, I think, between Federal Ministry of Health, the UNICEF has been supporting with ensuring that this is implemented. And these processes are done in most hospitals now for many years now, and is the early initiation of breastfeeding and also putting the baby to the breast as soon as possible after childbirth to ensure that breast milk is produced quickly. And then encourages community level IYCF promotion, which is related to the behavioral change that I mentioned in the last slide. So I'll be moving on to the next one, which is the nutrition sensitive policies. So these are laws, these are policies, guidelines that are implemented. So for the Labour Act of Nigeria, we initially had a 12-week maternity leave, but of recent it has been increased to 6 months of leave, which is still under various legislation because not all states in Nigeria still have started adhering to this 6 months of leave, but there's still an ongoing process between Federal Ministry of Health and then UNICEF and other supporting NGOs as well. Then this policy also ensures that it's nursing mothers, breastfeeding mothers are protected from unsuitable work conditions. But the gap here is that there aren't any formal support for breastfeeding at the workplace, in the sense that there aren't any mandatory guideline or law that stipulates that a workplace should make sure that they have a space, be it crèche, though it's recommended that they do, but it's not mandated that every workplace should provide this. And also the breastfeeding, there's no break specific time. Are we giving the mother 20 minutes or 30 minutes or 1 hour? Then flexible working hours, probably okay, she has to work, close from work earlier. If the job is 9 to 5 or 8 to 5, is she permitted to leave by 3 p.m.? This is not stipulated as a law or a guideline, but this will be a discussion between her and her employer or the HR in our workplace. And also the next one under this policy, under this nutrition sensitive policy, is a national social protection policy, which helps to reduce the vulnerability of men and children in various communities, and also helps with to support income, also the income and care environment. Then I'll move on to the third one on the slide, which is National Strategic Health Development Plan 2. It integrates the IYCF into maternal and child health services provided across board, both in the hospitals and outside of the hospitals, and also supports capacity building for health workers, which is in line connected to behavioral change programs, health education conducted for breastfeeding mothers, for pregnant women during pregnancy, and also the antenatal care that is being provided. Then I would like to tie this to the alignment of our policy to global frameworks. We are quite aware that WHO and UNICEF have a global strategy on the infant and young child feeding. They've been raising a lot of awareness, concerns, issues, proposing solutions to, and then also ways to mitigate some myths around breastfeeding. And they've also been working closely with the political sector, with the government, with the various stakeholders to ensure that breastfeeding practices are incorporated and the adequate complementary feeding practices also incorporate across board. And also they work with the government to ensure that an enabling environment is made available for working mothers, for caregivers, to ensure that they also provide their child or their baby with adequate breast milk while at work. And for the ILO, I can recall that the ILO stipulates a 14 weeks maternity leave. I know quite few African countries are there to this rule, but previously, Nigeria wasn't adhering, but of recent, that the maternity leave was increased from 12 weeks to about 6 months. They have been adhering to this rule, though there are still some shortfalls. I'll move to the next slide. Yeah, there's still some shortfalls. And this legislation of the 6 months leave is just across, I think, about 10 states in Nigeria. Borno State, they just recently passed this, and Kebbi State, I believe that should be around last week. That was in the news. And then Oyo State, Lagos State, and other states have done theirs. So UNICEF has been working closely with the Federal Ministry of Health and the Nutrition Department, the Ministry of Labor, to ensure that this 6 months of leave is maternity leave rather is passed into law. Though there are still few gaps, like I mentioned earlier, breastfeeding breaks and workplace lactation support are not consistently implemented in the private sector and the informal sector. The formal and the informal sector. So I would like to just spotlight some contributions of some of the NGOs or international NGOs that we have in Nigeria. UNICEF has been doing a lot of great work over the years on advocacy regarding breastfeeding, exclusive breastfeeding for the first 6 months, followed by continued breastfeeding with appropriate complementary foods until 2 years. Then the baby-friendly hospital initiative I mentioned earlier was about encouraging immediate skin-to-skin contact after childbirth and early initiation of breastfeeding. This is done in collaboration with the Federal Ministry of Health. This has been passed across all government-owned level hospitals. And then they've been doing a lot of work in policy advocacy to ensure that maternity leave is being extended from the initial 12 weeks to about 6 months that we have now, and across the states which I mentioned earlier. And so they're working closely with Federal Ministry of Health as well. Then also they work with the grassroots, community health volunteers, staffs, feed staffs, and then health workers in the various low and medium income communities who might not be able to get much information, and then you have to cascade information to them, give them a practical way how they should breastfeed properly, why they should breastfeed, because they have so many barriers, misconceptions that could hinder them adhering to exclusive breastfeeding. And these trainings, this health education and talks will help to demystify these misconceptions and barriers. So I also moved to one of the organizations doing a good work with advocacy on breastfeeding support is GAIN. GAIN is Global Alliance for Improved Nutrition in, and they've been working on some pillars, which they call workplace or workforce nutrition. So the pillars are focused on ensuring that people have adequate nutrition at work. So in addition to that, they have included breastfeeding support as one of the pillars that both informal and formal sectors need to implement. The organizations and companies where they have women, because some organizations might have just male workers, they might not need to adhere to this policy or rule. But for those that have female workers, pregnant women, working mothers, they have to adhere to the maternity leave and also provide some room for paternity leave as well. So a new father to a newborn baby can also take some leave to attend to the baby and also provide support to the mother who needs some rest and also some support as well. Then also flexible working hours. So this could be probably she has to close earlier from work or take some few hours of breaks. This will be between the HR or the employer and then the working mother. And also they have a book, a guideline that provides a recommendation and steps to creating or having a breastfeeding room that is conducive for both the mother and then the baby as well. Then I also spotlight some other organizations such as Alive and Thrive. They've been doing a lot of work with IYCF practices, advocacy, policy support with the government, the nutrition department in the Federal Ministry of Health, and also Save the Children has been advocating over the years for stronger breastfeeding policies. And also, they've been providing breastfeeding counseling services through various programs they've been doing across board, especially in the low income communities. So, or tagged as the bottom of the pyramid communities, then also USID, WHO, and also we have NSN. NSN is Nutrition Society of Nigeria. They've also been doing a lot of work liaising with the government, stakeholder, and other academia to ensure that exclusive breastfeeding is passed across and the policies are there too. And I'll just close with spotting the gaps and opportunities. Like I said earlier, there's limited workplace breastfeeding support in terms of the flexible working time. There's no mandatory or mandated law or policy that states, oh, you should provide a working mother with maybe 2 hours break to go attend to her child, or maybe is it 2 to 3 1 hour break, or is she closing early from work? Probably if it's a 8 to 5 job, she has to now leave maybe by 4 p.m. or come in by 9 or 10, and just so there are not mandated laws or policy that states a particular time that working or breastfeeding mothers should resume. And also there's the need for longer paternity leave. While we understand that yes, we encourage or advocates for paternity leave. We are quite aware that in Nigeria, not all organizations or companies are there to this rule, but there's the need to also promote advocacy on the need for fathers to also take leave to attend to take care of their baby and also take care of the mother as well. Then also weak enforcement on existing policies. A lot of companies do not follow up with some of these policies because there are no adequate follow-ups, there are no adequate steps put in place to ensure that probably government parastatal goes around to check on each company that is registered to ensure that all these policies are being adhered to. So these are the gaps that have been identified, or few of the gaps that have identified to bring out for this discussion. And then I'll close with saying that a strong policy framework exists, but implementation and enforcement remains a challenge. And I would say strengthening both nutrition specific policies and nutrition sensitive policy is key to improving breastfeeding rates in Nigeria and across the globe, and also ensuring that there's improved child nutrition outcome. That will be all from my hand, and I do hope I have used my 10 minutes judiciously. Thank you for having me. All right.
Thank you. Okay, I will not speak to the time. Thank you very much for the presentation, and yes, for trying to highlight the different policies that exist and some of the gaps in the implementation. I have a question, but maybe I will leave it till the end about non-formal sector. What this some of this policy looks like in non-formal sector. For instance, a woman who is a farmer, how does she plan for maternity leave when she needs to, keep maybe farming to get her distance? But anyway, thank you so very much for your presentation. I would now like to bring up the next speaker. Valerie is a registered and licensed nutritionist based in Kenya with over 3 years of experience in both clinical and public health nutrition. She currently works in a hospital setting where she provides evidence-based nutritional care and supports patients in managing various health conditions through diet. Val, as Foundicor, holds a bachelor's degree in nutrition and dietetics and has been actively involved in community nutrition initiatives aimed at improving health outcomes at the grassroots level. Outside of her professional role, she creates educational nutrition content to raise awareness and empower individuals across Kenya to make informed and healthy dietary choice. This afternoon, I would like to invite I say my Kenya system. I hope I remember my Swahili, Abari Yajioni. Uh, Valerie, I would like to then pass this over for you to start your presentation. Sawa, right? Sawa, sawa. Thank you. Okay.
Hello everyone, can you all see my screen?
Yes, we can see your screen and we can hear you.
Okay, so good. In Kenya, it's already evening, so I'll just say good afternoon, good evening, everyone, and thank you for being here. My name is Valerie, as Mercy introduced me. So today we are talking about breastfeeding, and this week's theme is prioritizing breastfeeding to create sustainable support system. So I'll start by talking about the current Kenyan situation in breastfeeding. Kenya has made a remarkable progress in promoting breastfeeding between 2003 to 2022. Exclusive breastfeeding in the first 6 months increased from 13% to 60%, surpassing the World Health Assembly's target of at least 50% by 2025 and exceeding the 2023 global average of 48%. But in 2030, the WHO is aiming towards 70%, but we've stagnated for about 10 years at 60%, meaning there is some gap that we need to fill as health practitioners and as breastfeeding moms in general. This progress is the result of sustained investment in a comprehensive package of maternal and infant child interventions. This includes the breastfeeding counseling at health facilities, implementation of World Health Organization's baby-friendly hospital initiative and a baby-friendly community initiative, which I'll talk more about in the later slides, and enforcement of the Breast Milk Substitute Regulation Act of 2012, which mainly focuses on the marketing and distribution of breastfeeding substitutes and also promotion of breastfeeding. So despite these efforts that WHO and UNICEF has taken, exclusive breastfeeding rates, as I said earlier, have remained at 60% since 2014. So why are we championing for breastfeeding? So first of all, one of the things that we recommend is early initiation of breastfeeding. WHO and UNICEF recommends that initiation of breastfeeding should be within the first hour of birth. So when you give birth immediately, within those minutes, within the 60 minutes, you should have already initiated breastfeeding. So why do we do that? is because it has shown to reduce neonatal mortality. It has also shown to support thermoregulation and bonding. So thermoregulation and bonding is through the skin to skin that the mom and the baby gets to do, and especially for babies who are immediately born and given to the mom, and they are placed on the chest literally. So that's what the skin to skin is, and that supports the thermoregulation. Next, it stimulates milk production, and it has been shown that moms who initiate breastfeeding in the first hour are more likely to have milk output faster than the moms that would take a longer period to initiate, because then there is a connection, and there's a hormone that helps with production of milk, which is stimulated by the first touch of the baby onto the breast. So next, it also stimulates the release of oxytocin, which is a hormone that helps in the uterus contraction, thus reducing postpartum hemorrhage, which has been something that has been a concern of late. And also, it also promotes uterine recovery. There's been so much, this reduces maternal deaths. If postpartum hemorrhage is reduced thus, at the end of the day, we are able to reduce maternal deaths. So factors that affect early introduction of early initiation of breastfeeding. First one is antenatal care attendants. When they're able to attend this antenatal cares, they're able to have knowledge on time of breastfeeding and initiation during pregnancy, and it has shown that it is three times more higher to find that moms that who have attended antenatal care and have been taught about early initiation and breastfeeding for 6 months, you find that they are able to initiate breastfeeding 3 times better than the ones who have not attended the antenatal care, because then they don't have the knowledge. So at the end of the day, they do not initiate breastfeeding on time. Next is delivery at baby-friendly hospital initiative facility. Such facilities, they have steps which I'll talk about more in detail. So this enables mothers, the hospital itself will enable the initiation of breastfeeding, because there are regulations and policies and rules on how that goes about. Next is mode of delivery. We have 2 modes of delivery. One is the cesarean section, and the other is the spontaneous vaginal delivery. With the spontaneous vaginal delivery, this is what we call the normal delivery, where you find that the moms are able to immediately even do the skin to skin, and they are able to initiate breastfeeding faster. But then for the women who go into cesarean section, which has been something that has been on the rise in Kenya, I'd say, especially some come for electives, CS, but some you'd find it's just an emergency situation. So if those who go for elective, they have decided, or they had a previous scar. So for cesarean section, you find because of the anesthesia that they were given, the initiation would take longer than the one who gave birth normally. The last one on factors affecting initiation of breastfeeding is skilled birth attendants. So if there is knowledge and skills in the people who are helping in the delivery, you find that they'll be able to conduct the initiation within the first minutes of birth or the first hour of birth. Importance of exclusive breastfeeding. So what's the recommendation? Currently, the WHO recommends exclusive breastfeeding for the first 6 months of life, and continued breastfeeding with appropriate complementary feeding for up to 2 years and beyond. So exclusive breastfeeding, why do they need exclusive breastfeeding? Why is it just breastfeeding? So exclusive breastfeeding supports optimal growth and development, because the breast milk gives us all the macro and the micronutrients that babies need for the first 6 months of life for growth and development. Secondly, it builds strong immunity. So strong immunity in the sense of, in the first day 1 to day 5, there's a milk called colostrum. We tend to call it the liquid gold, because then it has antibodies that helps with with the immunity. So at the end of the day, even if you compare the children who breastfed for 6 months and the children who didn't get to 6 months, moms would explain, even if it's in the same household, maybe the firstborn breastfed to 6 months and the secondborn maybe got to 3 or 4 months, they would say that the firstborn has stronger immunity compared to the secondborn. It also enhances brain development in terms of breast milk has DHA, which is known to help with brain development. And we find that these children are more sharp in class, so they are more intellectual. They have a higher IQ compared to the children who don't breastfeed for 6 months. So it also reduces risk of acute infections like diarrhea, pneumonia, diarrhea in the sense of if the breast milk is just on the breast, so they're not exposed to the surrounding, which would cause infections and all that. Next is it reduces risk of chronic diseases later in life. So later in life, these chronic diseases include diabetes, hypertension, and obesity. It has been shown that children who breastfeed for 6 months are likely to not to acquire these diseases. It just reduces the risk of them acquiring compared to the ones who didn't get to 6 months. So breastfeeding is not important only to the children, but it's also important for the mom. Number one, it promotes faster postpartum recovery. So faster postpartum recovery is in the sense of, like I said earlier, the hormone oxytocin, which helps in the uterine contraction. So when they start breastfeeding, from experience, when they start breastfeeding, you'll hear them saying they're feeling some pain on the vaginal area or on where the C-section was done. So that is because in that moment that they're breastfeeding, the uterus is contracting. So that's why you find that at the end of the day, it just helps with the recovery. Secondly, it helps with natural birth spacing. So it's like a contraceptive in a way, but then that's questioned a bit because some moms talk about sometimes they end up getting babies, or so it's not too, it's different from person to person. So this is just different from person to person. Or it reduces the risk. It has been shown to also reduce the risk of certain cancers like ovarian cancer and breast cancers. It supports emotional bonding. So when they're doing skin to skin, when the mom and the baby is breastfeeding, you find that there's that strong bond that is being formed between the mom and the baby. And also, even the babies that are in the NBU or the NICU, you find that there's this program called Kangaroo Mothers, where they just hold a baby like a kangaroo. It has also shown to be, it helps in healing of the baby. So at the end of the day, the bonding and the emotional bonding that comes with that also shows to be a healing thing for the children as well. Next, it's economical. So breast milk is safe, easily accessible, cheap, and right temperature. So mom doesn't need to think about where to get it or spend money to get the breast milk. Also, it reduces cost in healthcare because now the baby won't be getting sick, so they are able to control that. So how do we successfully achieve breastfeeding? So number one, this is the 10 steps of successful breastfeeding, which is under the Baby Friendly Hospital Initiative by the WHO and UNICEF. This is what my colleague earlier talked about, but now I'll be talking about it in details. Number one, we have hospital policies. So in hospital policies, we have compliance with the International Code of Marketing of Breast Milk Substitutes. So in this institution, we should not be promoting like infant formulas or like teats, and then making breastfeeding care a standard practice. Like it should be at the back of the mind of every hospital care or the specific hospital that the first thing that they should be doing is introducing breastfeeding. Next is staff competency. So in staff competency is making sure that the staff that are attending to these mothers are competent in the sense of they know how to, they can assess the breastfeeding, they could know the challenges that the mom is going through. They can teach the mom about the importance of breastfeeding. They can support the early initiation of breastfeeding. Next is antenatal care. Like I said earlier, it also promotes, when you're going to an antenatal care, it promotes the early initiation of breastfeeding, because of the knowledge that you will get through the discussions that you will be getting from the staff that you'll be meeting there. So it helps in discussing the importance of breastfeeding for babies and mothers, and preparing women in how to feed their babies. So that's what I've just said. Next is care right after birth. So care right after birth encourages early initiation and skin-to-skin contact between mother and baby. So immediately the baby comes out of the mom, the first thing is skin to skin. So that is the first care after birth, and then the early initiation. Next is support mother with breastfeeding. So how do we support mothers with breastfeeding, especially first moms? Second moms or third moms, they're able immediately, because they have already experienced how breastfeeding is, they're able to know what to do. But then first moms are a bit confused and all that, even if they went to the antenatal care. So that's where supporting them comes in, where you can help. You can be checking the positioning and attachment. If it is poor, you can help to make sure that they get it right. If they're having any challenges like a cracked nipple, like milk flow is low, you get to assess and also encourage them. Next is supplementation, whereby we encourage that the only thing that should be given to the child is only medication and the vaccines that we give during the first days of birth or the first months of birth. But the main thing is to just promote breastfeeding. And if there is no breast milk, or maybe the mom died or something happened to the mother, the UNICEF and WHO talks about prioritizing donor milks. But in Kenya currently, we don't have many donor milk. It is not popular, or like wet nursing. Those are things that are not popular in Kenya, and I think it's one of the things that it should be taken account, because some moms, even maybe the baby died and they could help out to the other babies. So yeah. Next is rooming in. This means that the mom and the baby should be in one room, even if the baby is in the NBU, or the baby is okay and is on bedside, should be bedside with mom. And if the baby is in the NBU, they should be together. That's why I talked about kangaroo nursing, whereby they can hold even the baby, even if the baby was in the incubator. Next is responsive feeding. This responsive feeding just covers about the feeding on demand. So feeding on demand, immediately the baby wants, just give them. It doesn't mean that they have to wait like us, breakfast, lunch, dinner, all that. No, you just have to feed when the baby wants. And you find that newborns tend to sleep a lot. So if they sleep a lot, don't be a happy mom when the baby is sleeping a lot. You should be like, after 2 or 3 hours, you should wake them up and feed them. Because if you're excited about not feeding because the baby slept longer and you get time to sleep, then you're encouraging malnutrition in this baby, and they can even get micronutrient deficiencies later in life. Next is discouraging teats or feeding bottles or pacifiers, because when we do this, we get to, the children would neglect, at times they can even neglect breastfeeding, because then the pacifiers tend to be like, they look like nipples. They feel like nipples. So if your nipples are not as comfortable as them, you'll find the baby will stop using them. And also the baby would prefer that more. And then you'd find that now you'll start getting engorgement, because you're not breastfeeding enough. You're just feeding using the bottles. And now it will cause other problems. So the main thing is not to encourage use of pacifiers and teats and bottles. And lastly, discharge. This is when we are discharging, we should give, there should be a strong support system. This is whereby the spouse, the family members, and then now the community comes in, where you can now refer them to community health workers who will help with the breastfeeding, and also they can join other moms support groups, where they can learn more about breastfeeding. So finally, how do we support successful? How does support look like? So my other colleagues who have spoken have spoken about this a lot, so I will not talk about it in details. So how support looks like is strengthening community health system. This is using the CHVs, training them and deploying them and to teach about breastfeeding. And then next is improving access to nutrition for lactating mothers. So how do we improve access of nutrition to lactating mothers? We all know that proper diet equals good quality milk. So we should advocate for better nutrition for these mothers. And at the end of the day, in low income or low resource centers, we can use community gardens, local food demos, or nutrition sensitive programs like the way my colleague talked about GAIN, UNICEF, and also other organizations that come in play to help with such programs. So at the end of the day, the moms are literally covered or given like food assistance to just help with the breastfeeding. Next is leveraging existing community platforms. So these community platforms are like churches, barazas, chamas, where women meet. So at the end of the day, they get to learn. When you leverage these places, they get to learn from even the leaders who are there, the church leaders, the influential mothers or women. So at the end of the day, they learn something from that. Next is engaging male partners and broader households. So engaging male partners is just engaging them in the topic of breastfeeding, enabling them to give support as much as they could. And also they can, broader household includes even grandmoms, aunties, uncles, they're the ones who comes with myths and misconceptions. So at the end of the day, they could influence how the mom breastfeeds. But if we engage all of them and we give them the knowledge about breastfeeding, at the end of the day, it will help with that. Lastly, support breastfeeding at workplaces and informal sectors. So my colleague talked about that, so I'll not talk about more of it. So let's champion for breastfeeding. Thank you for listening to me.
Thank you so very much. Valerie, that was very interesting. I heard a very in a unique word today that colostrum is liquid gold. Okay. So I'll take note of that. You also mentioned the gaps in wet nursing, and I also heard that don't be a happy mom if the baby is sleeping longer. That means you are trying to lay a foundation for malnutrition. Thank you so very much. For the remaining time that we have on the call, we'll try and see if we can finish as scheduled in the next 12 minutes. We'll see about that. Otherwise, if we run over, that will be me taking back my 5 minutes that I allowed for more people to join. So please, I just wanted to keep that in view. So now, the three presenters are presented from the context of Morocco, from Nigeria, and from Kenya. And one thing that is certainly very central is the fact that there are gaps in implementation, whether is at the policy level or at the community or public health level. So you also made reference to some of the myths that may be hindering effective breastfeeding. So to help us debunk some common myths that we have been able to aggregate, I would like to invite our speakers also as I ask the question. I would like to start with Dr. Rabbi, who I have 3 or 4 questions for her. Let me start with the first one. There is a perception that breastfeeding is painful. I think Valerie mentioned in one of our discussion earlier. So like some feel like maybe breastfeeding is painful. What as a professional and also someone who has researched on breastfeeding, what are your thoughts on this? Is this true or is it a myth?
Ok. Merci beaucoup pour cette question très intéressante. Effectivement, on pense que allaiter est pénible. Allaiter est pénible quand c'est mal fait, quand c'est quand il y a un problème dans la position. dans la prise du sein. On sait que il faut pas prendre juste le mamelon, il faut prendre toute l'auréole, toute la partie marron du sein. Et c'est pour ça qu'on dit que c'est très important de bien former les mamans pour l'allaitement maternel, pour que ce soit pas pénible. Être bien assis, correctement donner une bonne position, une bonne prise. Ça d'une part. D'autre part, être peut-être pénible, c'est le fait que la maman n'a pas la liberté de sortir quand elle veut. Ce n'est pas vrai non plus, parce qu'on sait qu'aujourd'hui, on peut tirer le lait, on peut bien le conserver. Il y a un guide de conservation du lait. On peut le conserver 8 heures à la température ambiante. On peut le conserver au réfrigérateur ou au frigidaire pendant 12 heures. On peut le conserver au congélateur. Donc la maman peut avoir la liberté de sortir quand elle veut et lorsqu'elle veut, elle peut être libre. Donc, allaiter, ce n'est pas pénible. La troisième chose qui est importante, le fait d'allaiter, ça permet de sécréter ce qu'on appelle les hormones du bonheur. La maman, après, quand on parle de prolactine et de l'ocytocine, c'est elle qui permet l'éjection du lait et elle donne une sensation de bonheur et de bien dormir. Donc, c'est une fausse idée de penser que allaiter fait mal.
Thank you. We couldn't hear that in English. So I don't know if Dr. Yorens and
Oh, sorry, I was talking and I did not realize that I'm on with it.
Il n'y a
oh,
Sorry.
pas de
Okay, she said that breastfeeding is not painful. That is only myth that believe that holds having is very painful to breastfeed kids.
okay.
That is not
Okay.
true. Discomfort or failure or to latch are
I don't want
inevitable, but with
explain my
good
answer.
support and
I
guidance,
want to
breastfeeding can
tell you
be.
that it's not pain to breastfeed, but because the first is the position, how to practice this breastfeeds when we give we give feed to baby. We have to learn how to do it.
positioning and
The
attachment.
third Yes, the third, that when we practice breastfeed, we secrete oxytocin. It is a hormone of happiness. So the mother is in a good, how to say it?
Excited.
She is happy. Yes, she is happy, and it's not true to say that say that it's a pain.
It's not
I
painful.
hope my
Yeah, you did
idea
well.
is
Sebon. Sebon. Yes, you
okay.
tried. Thank you.
I'm practicing my English with you.
You're
Thank
doing
you.
well. We need to do exchange. I learned French, you do English, so Sebon.
Okay.
Okay, great. Okay, I will ask the next. Oh, okay, I'll ask the next question also to you before I move to Ade Ronke. So another okay, I think let me move the question that says you must eat excessively during breastfeeding. Is this correct? Like some people will say, oh, let me eat. I'm eating for three people. I'm eating for two, depending on the number of children. Do you really need to eat excessively when you're breastfeeding?
No, it's not true. We have not to eat more, more quantity, but we have to eat more quality. A mother, if she's not, she don't care about her nutrition before avant breastfeeding.
No, you can
In
speak in
breastfeeding,
French,
she
please.
has to be
You can
care
speak in
about
French if
her
you are more
nutrition.
comfortable. Please, you can speak
Ok.
in French. I think Dr.
Ah, ok.
Yerens was
Très bien.
muted. She was muted earlier, as I think she was speaking and she was muted. So please.
In French, I can speak
Yes,
French
yeah.
now? Ok.
Mhm.
So, la maman ne doit pas manger plus. Elle doit
Uh,
manger mieux. Si avant
mother doesn't
elle ne
need
mangeait pas très bien,
to eat
pendant la
too
grossesse,
much,
elle
but
doit faire
eat
attention à
in
cela.
qualitative,
Elle ne doit pas
in
augmenter la
quality.
portion.
She doesn't need
L'alimentation
to eat
fonctionne
many times
puisque
in during
500
the day. Just
kilocalories,
follow the rules
c'est
that
l'équivalent
she
d'une heure
eats
de sport. Vous voyez, c'est très bon pour
all
la
group
santé
food
parce que ça
groups
nous
necessary
permet de
for her,
brûler
appropriate for her,
des calories
not in
extra.
too much quantity,
Aussi,
but in
ce qui
quality.
est intéressant, c'est que
What is interesting,
cette maman, elle doit manger de bonnes protéines. Elle doit
she
manger
must
des
eat
légumes, surtout les légumes
proteins,
et les fruits qui sont très
legumes and
importants.
fruits.
Elle doit manger les céréales complètes.
She just want
Elle
a
doit
complete
s'hydrater.
cereal
C'est beaucoup plus l'hydratation. Il n'y a pas un aliment
and drink
scientifiquement prouvé qui
water,
augmente la
well
quantité de
hydrated.
protéines. Il y a une bonne alimentation saine.
A
On
good,
augmente juste de 500 kilocalories par jour en quantité. Mais sinon, le reste, il faut que juste une alimentation équilibrée. Voilà.
just she just have to follow a good diet, not thinking about eating too much, taking too much calories per
C'est bon,
day.
j'ai fini la réponse.
Yeah, eating too much calories, but think about eating more protein, good proteins, good a lot of legumes and fruits and complete cereal. Avoid a lot of cholesterol, lipids, those kind of things.
Mm,
Thank
thank you. Merci beaucoup.
you.
Okay. Another myth is that, another common belief is if you skip breastfeeding one day, your milk goes sour. Is this correct, Dr. Rabbi?
Ah, ça, c'est la question courante et qui me fait rire. Euh, le sein n'est pas une boîte. Il n'y a pas de date de péremption.
Euh, c'est une question qui me fait souvent rire parce que le sein est, oh,
Le lait
because
est
this
extrait
question make me laugh
et le
because
bébé
this
prenne le sein.
the breast
Le lait ne pourrit pas
milk
jamais
don't
avant d'aller au biberon. Donc, faire attention. Même si je reste 10 jours sans allaiter au sein, le lait ne lui arrive rien. Par contre, ce qui risque d'arriver, c'est l'engorgement. C'est le sein
breast
qui
milk don't
s'engorge rapidement.
get
Ce
worse
qui peut
after
arriver,
days.
c'est
No,
qu'en
it's not
décidant de
like
tirer le
canned
lait
meat
quand le bébé ne tète pas. Parfois, la maman est
canned
obligée d'arrêter
milk powder that
pour
could be
un
get
médicament
worse
ou
after
parce que l'état du bébé ne
when
va
you
pas.
leave it too long. No, breast
Donc,
milk is
ces
not like that.
grossesses,
Don't not
ils vont
spoil
suivre normalement.
at all. It can be used anytime.
Voilà,
But
c'est
the
normal.
problem when you don't don't breastfeed the kids meantime and maybe come back is more physical congestion of your nipple. That's it. What you can have what you can have as problem, but not spoiling milk. You can give your kids anytime this milk.
Thank you. All right. So the last question, we'll run a bit over if you don't mind. So sorry about that. We tried to keep to our time, but yes, today we are a bit, yeah. It's interesting. Let's just take it as done. So the last question is for Dr. Rabbi is that malnourished or sick mothers shouldn't breastfeed. Is this correct? That when a woman is sick, she should stop breastfeeding? Or does it mean that she produce bad milk or yeah?
There isn't bad milk. Only doctors can tell you that you have not to give milk, mother milk. Because mother have diseases who can
Be transmitted.
pass in the milk.
Transmitted to the baby.
Only doctors can say that. But never the milk, mother's milk is the good nutrition for baby in all conditions. Même dans la grippe H1N1, même dans la COVID, même quand il y a des maladies dangereuses, c'est-à-dire
No
infectieuses,
matter
le lait de la
disease
maman
of the mother,
protège le bébé.
she must
Ça
breastfeed.
reste le meilleur
No
médicament.
restriction for
Sauf
breastfeeding.
si le
She
médecin
must
contre-indique. C'est le
only
médecin
when
qui a la
the
possibilité de
doctor say
prescrire
that you
le
cannot
lait
breastfeed,
pour
only that
telle
case.
maladie ou
If
telle
not,
maladie.
no matter her disease, she could breastfeed her kids. There is no restriction for that.
Okay. Thank you so very much. I would like to move to Ronke and also ask the same question. What are your thoughts about a sick mother breastfeeding?
Oh, sorry, I was muted.
Okay, sorry.
Okay. So from my own understanding, okay, let me turn on my audio,
Yeah.
my video. Yeah. So from my own understanding, there's no problem with breastfeeding mother breastfeeding a child if she's sick, except she's having to take some medications, which the doctors or nurses that prescribe the medication will tell her that, oh, she needs to abstain from breastfeeding. So probably she needs to maybe express early in a bottle before she takes the medication, and then she might be able to breastfeed maybe after 2 hours or after 3 hours. But most times I'm quite aware that doctors try not to give a medication that will prevent the mother from breastfeeding for a long period of time because she needs to attend to her child. So it will be for a specific time, and that's on mostly rare conditions or rare occasions.
Yeah.
Yeah, I hope that helps.
I think I like the idea that even if she has to take medication, she may
Yeah, she
express the
can.
breast milk
Yeah,
before she takes her medication, so the baby still
yes,
have access to the breastfeeding.
yes.
Okay, thank you. I have another question for you.
Okay.
Some people think that breastfeeding for too long harms a baby. Like if some believe that prolonged breastfeeding affect growth or causes dependency, even though the WHO recommends, breastfeeding up to 2 years. If you see
Yeah.
somebody who is breastfeeding a 2-year-old, people are like, oh, what are you even doing? Like, why is this boy still breastfeeding? So, yeah, what are your thoughts about that?
I believe there are just myths or misconceptions over the years because there's nothing as saying breastfeeding too long helps the baby or harms the baby. So it could just be maybe an occasion of maybe the mother is being stressed. She could express, I know we are in a age that we can express your breast milk now and then give to the baby later. That helps you to let other people tend to your baby while you do other things. But breastfeeding doesn't hurt the child. It provides.
I think your video doesn't want us to see your fine face.
Oh, okay. Let
Just
me
bring it
just pause
back
it.
again.
All right. Can you hear me better now?
Yes, it's better without the
Yeah,
video.
so I'm saying breastfeeding, either some people tend to do beyond maybe 2 years. God bless them. That's maybe depending on the mother, she wants to do beyond 2 years. But I know WHO says up to 2 years,
Yes.
exclusively for 6 months. So breastfeeding doesn't hurt the child. I know the only thing that can maybe cause some perceptions regarding that is maybe the mother is quite stressed. She needs some time alone so she can express the milk in a bottle and let someone else, maybe the father or a guardian or a caregiver around, can just breastfeed the child with, I mean, give the baby the bottle that contains the breast milk. That way she has some time to maybe rest or take care of herself. I know from my interaction with some breastfeeding mother, they are too stressed and then they feel like, oh, the baby cries in the night, cries too much. And the baby, because we know their stomach is quite small. So from time to time, every maybe 1 to 2 hours, the baby wants to breastfeed and the sleep is getting a bit deep. And then you wake up, you breastfeed, then you go to sleep, it's not long, you hear the cry, you breastfeed again. So I think breastfeeding, we have breastfeeding pumps they can do now, and then you express the breast milk, then someone can help you give your baby the breast milk while you sleep, and that way things go well. If a mother wakes up healthy and happy, well, refreshed, and the baby too is well fed and tended too. So I think it just depends on how the mother can handle some of these things. But no scientific evidence has backed that breastfeeding for too long will cause harm to the baby.
To the baby
All
or
right,
even
that'll be all for me.
yeah. Even don't we all take cow milk even as adults? So
Yeah, that's true.
yeah, so I mean, okay, some also think water or herbal fluids are needed alongside breast milk. Uh, is this correct? Is this a myth?
Okay, I would say it's a myth because a baby doesn't need either water or any fluid except a medication or vaccines provided. Because breast milk is mostly water. I guess I think 80% water. So even if a weather is hot or whatever, the breast milk comes with in different composition. So the breast milk that is being expressed or given to the child is based on the needs of the child. So there's a chemistry in how the body of the mother works to provide the child with however ways if there's need for more immunity on in the child's body, the breast milk will contain more antibodies rather, that
Mm,
would help the baby to fight whatever infection. And giving the baby other fluids, water, or maybe hepatic or medicine can even cause harm to the baby because you don't know the baby's body is not immune to some of these things, which is why they tell you that just give breast milk alone. Because some of this water might contain some bacteria that might be harmful to the child. And also giving the child other fluids would reduce the amount of breast milk that you give to the child because that would take a part of the quantity of fluid that the child can take in. But if it's exclusively, if a child is being exclusively breastfed, the child takes only breast milk which has water to cater to the needs of the child and other things. So, like WHO and UNICEF says, they strongly recommend that no full fluids, no water for the first 6 months. The breast milk alone is able to cater for the needs of the child.
mm.
Yeah, that'll be all for me.
Thank you very much. And the last question I have for you, some people think breast milk is insufficient, especially to aid the growth of the child. So they think, how can this baby be taking only breast milk? It's how would the baby grow? So they start to
Yeah.
introduce things like butter, shea butter, honey, some porridge like maize grass and all that. So I mean, I know you had just said about the 6 months, but what do you think breast milk is insufficient and yeah, at what point does it become insufficient?
All right, thank you. I do not think breast milk is insufficient, except on conditions whereby the mother is not producing enough breast milk. Then you might have to substitute with formula or maybe some places they have wet nurses, then the wet nurse can just attend to the baby. But except for that scenario, then the breast milk is sufficient for the child. Like I said earlier, the breast milk would be produced based on the needs of the child. So there's a way the body works
Mm,
that whatever needs the child, whatever needs that the child needs, rather the breast milk will be able to provide. So if the child is going to fall sick on an illness and needs antibodies, the breast milk that will be produced, if it's taken to the lab at that moment in time, you would notice that there are more antibodies rather in the breast milk during that period when the child is ill, and then the child will be able to fight the illness or the sickness. So giving honey is even harmful because the baby's digestive system is not well developed to
mm,
even undo something like honey or shea butter or any other solid. So giving solid before 6 months is even harmful to the child. The child could choke, might not be able to swallow well, or
mm,
some issues with the digestive system because it's not yet developed to handle solids. It's only breast milk that the stomach can handle or can digest for the period of 6 months. Then from 6 months, or some people say maybe few weeks to 6 months, some babies can take solids, but only shea butter and all, it's not advisable because you could be causing harm to your child while trying to even say you're doing good. So the best thing is just stick to breast milk alone, except if you're not having enough breast milk. And then they advise that you go ahead with formula, then you can go ahead with the breast milk formula. So, all right. I hope this helps.
yes, thank you so very much. I would now like to move to Valerie. I sincerely apologize that we are running over, but I'm honestly enjoying this myself. So,
Yeah,
uh,
same here.
so yeah, we are really learning together. Okay, so I'd like to move to Valerie. I know you had mentioned in your presentation, but some people believe that colostrum is liquid, the liquid gold. I think that's one word I'm certainly going, with today. But people, even though you had described this as good, some think colostrum is bad. Is this a myth? Is there something they are missing that we need to let them know?
Okay. So colostrum, the reason why it's liquid gold, it's because of the color. It's goldish in color, I'd say a bit of mustard color. And it's produced between 1 day, day 1 to about day 5 of birth. And it is a myth because this is the milk that has antibodies. It's the first milk that the baby actually takes in. So it is one that actually boosts the immunity of the baby by introducing the antibodies first. Secondly, it also makes their gut health stronger because it's the first thing that goes into their stomach. So definitely we've been able to also reach their gut health and making it stronger. And also it also helps, it's sort of a laxative as well because it helps to remove, or they're able to pass stool, which would enable most of the babies not suffer from neonatal jaundice because they are able to produce meconium, which is the first poop that the baby produces. So it is a myth to me. Yeah.
Okay. Thank you very much. The next question I have for you is some people think in the Kenya context, I think that milk
Yeah.
becomes bad or caused after infidelity or conflicts. Is it Chira? Is that am I pronouncing well? Is that the right?
Chira. Yeah,
Kira.
yeah, yeah.
Okay, Kira. Okay.
Yeah, chira or chira.
Kira.
Yeah,
Okay.
chira. Yeah, something
Kira.
like that.
Okay. Thank you.
Yeah.
So
So
what is Kira or is it Mayasi? What is that? Like
okay. I'll be honest, I think it's just a name. I actually don't know. But it's like I'll just say it's just a name of whatever that it's like a curse or something. That I think that's what it means. But basically, or a bad omen or a taboo to be yeah, so that's what it means. But then it's just something to promote ethical or just discourage infidelity, but it is a myth because at the end of the day, there's no evidence to show that the milk would go bad because you went outside with someone else. So at the end of the day, it's just to discourage infidelity. So yeah, that's why I think that was brought up in the community aspect of it. Yeah.
Okay, thank you very much. I think, yeah, one of these questions I want to ask you, it's been answered in a way earlier, but I just wanted your thought also about the fact that this breastfeeding is painful. But maybe before you can just take the two together, and then there's a concept also that baby must be named before breastfeeding can begin in some context. In some Kenyan communities, I see, it's still the same Leo, some community too, they believe that until you name a baby, officially named, you are not supposed to breastfeed. So, how,
So yeah, some communities believe that, but then it is not something. I'd say it's a myth. But at the end of the day, we also a little bit have to respect the beliefs. But in the aspect of respecting belief, we have to remember that I talked about early initiation of breastfeeding, which is within 1 hour. So if you want to wait for our elders to come and start naming your baby and all that, at the end of the day, we are risking the baby's life. So at the end of the day, that's where education comes in, where we educate our elders and people in the community. So when we do that education, they will still come and name the baby, but not in the first hour of birth or something. They can still come and do the practices and name that baby, but not delay breastfeeding, because at the end of the day, there is no evidence to show that something will happen to the baby if they are not named before breastfeeding, but something will happen to the baby if they're not breastfed earlier. Yeah. And then now to the last one that you asked, about painful breastfeeding, that breastfeeding is painful. For my clinical experience, Even if it is a first mom, it's a second mom, it's a third mom, on the first day, they will say that they're feeling some sort of pain. But immediately you go help with attachment and proper positioning. Immediately, not even it won't even take longer. Immediately, they'll say they're not feeling anything on their nipples. So at the end of the day, it is just proper attachment and positioning of the baby onto the breast that will help with making breastfeeding even better. So the pain is just because of poor attachment, and so it's sort of you just need to get a practitioner that would help, and that's when the baby friendly health initiative. At the end of the day, you need a skilled practitioner, and also you need somebody who would support the mom, because if then she doesn't have the support, she'll stop breastfeeding because she's feeling the pain and she doesn't know how to express herself, because she feels like, oh yeah, I know that's the pain. Because second moms that I've met that never met a nutritionist or a guidance before, they mentioned that this is normal. I experienced it in my first baby and it's normal right now. So they forget that it is. I always make sure to remind them this is not normal and you can actually breastfeed without pain. It's just that prior you didn't have the knowledge, and then you find that they will also experience, the ones who breastfeed with pain will experience things like cracked nipple, or now because they're feeling that way, they might even experience engorged nipples, engorged breast because of that, because they don't want to breastfeed with the pain. Yeah.
Interesting. Wow,
Yeah.
we could go on and on, but we certainly have to bring this to an end. It's been such an amazing. Oh, Dr. Rabe, please go ahead, please. You have something to add.
Oui, je suis émerveillée par Valérie 5. It's good. Adoré votre intervention. J'ai appris deux choses. Je ne connaissais pas. La première, c'est l'infidélité et le lait maternel. C'est une information que nous n'avons pas. C'est une croyance que je n'ai jamais vue chez nous. La deuxième, c'est le fait de ne pas donner le sein avant de donner le nom au bébé. Deux informations strong for me. Merci
She
pour
said that
cette
she is
information.
very happy with Valerie's intervention because she just learned,
De ces deux mythes qui ne sont pas fondés.
never heard before in her culture that infidelity could affect the breastfeeding. So she never heard it before, and she's so happy to learn this, that there's people could believe that. So just it's just a belief. Fortunately, it's just a belief, and that we are happy that we can change people's mind about this, and yeah, there is no effect between infertility and breastfeeding.
Okay, thank you so very much. I'll give Dr. Sisoma some just like 5, 6 minutes to just recap. I learned that for the Aderonke's presentation, intervention on the questions and the panel session, I think they could hear during the actual presentation, but this panel session they could not hear. So if you can just help us recap the highlights in French, also so that people will see you as we have on this call today two co-moderators who probably you have heard their voice earlier and all that. So, Dr. Sisoma, if you can unmute, I hope you are able to speak. Let me check that you are able to speak. Please go ahead if you are able to.
Tout le monde. Je remercie Dr. Foulaké, je remercie Dr. Barabi du Maroc, Dr. Adorenke Alabi, aussi, elle s'appelle comment? Kenya, Dr. Valérie. Bonjour à vous tous. En tout cas, moi, je suis content une fois de plus. La première fois, c'était sur l'hypertension artérielle. Aujourd'hui, c'est sur l'allaitement maternel. Je suis cardiologue, voilà, mais voilà, j'ai été médecin généraliste, donc voilà, je peux en parler un peu. Donc, en résumé, nous sommes dans la semaine mondiale de l'allaitement maternel. Donc, aujourd'hui, c'était pour parler des influences de la culture, des communautés, des politiques, voilà, sur la durabilité et la précocité de, de, de l'allaitement maternel. Donc, du coup, au Maroc, au Kenya et au Nigeria, on a partagé un peu les réalités de chaque pays qui diffèrent certainement, comme docteur Bahal l'a dit. Et ça seront les pays, pas seulement les religions, hein, mais les ethnies aussi. Voilà, les croyances sont quand même différentes sur l'allaitement maternel. Donc, je pense que le côté français, docteur Baha a assez expliqué par rapport à l'aspect de la douleur voilà, quand on donne le sein. Donc, elle dit que c'est juste un problème de positionnement du sein quand on donne à l'enfant et que les mamans devraient être bien formées par, en tout cas, les professionnels de la santé pour qu'on puisse adopter la bonne position et donner le sein à l'enfant. Sinon, ce n'est pas douloureux normalement. Donc, sur ce plan, je pense que je n'ai pas beaucoup à ajouter. Et elle a dit aussi que la maman doit avoir une alimentation plutôt variée. Donc, elle ne doit pas manger trop, en tout cas par rapport aux autres personnes. Mais l'alimentation doit être variée et équilibrée. Donc, si cela est respecté, voilà, elle peut être dans les bonnes conditions pour allaiter. Maintenant, par rapport aux contre-indications aussi, elle a été claire. Donc, si le médecin estime qu'il y a une maladie qui fait que la maman ne peut pas donner du sein au bébé, en ce moment, c'est à la maman de respecter la contre-indication donnée par le médecin, parce que c'est lui qui sait pourquoi. Donc, les mamans doivent juste suivre les agents de santé qui savent pourquoi on ne doit pas donner dans certains cas. Voilà. Maintenant, par rapport à l'infidélité et la cérémonie du baptême. Moi aussi, j'apprends au même titre que le docteur Baha. Ça, ça n'existe pas chez nous aussi. Mais elle a reconnu que voilà, il n'y avait pas de rapport entre ces pratiques, en tout cas, et l'allaitement et la qualité de l'allaitement. Voilà, en tout cas, moi, j'étais très heureux de partager cette communication avec vous. J'ai beaucoup appris parce que, en tant que cardiologue sur l'allaitement, c'était un peu voilà, un terrain d'apprentissage pour moi. Je suis très content et j'espère que la prochaine fois, je pourrai être utile encore. Docteur Foulaké,
Okay.
I'm done.
Okay. Merci beaucoup.
Thank you very much for having me for this session.
Thank you so very much. I really appreciate. I saw a
Thank
and somebody said it can't hear anything. Oh, Jacinta, if you were listening in English, Dr. Sesoma was speaking French, so the only way you could hear was to speak in French. So he was trying to recap everything that the panelists had answered in French. Yeah, so yes, we had to like switch. So I had to switch to French to listen to him, even though I don't understand what he was saying, but I could hear him. I saw a hand raised earlier. I don't know whether the person um has dropped off, but what I could do is to just before we I would I mean we definitely have to leave in the next 5 minutes. I would just allow people to unmute, and then Jacinta, you can speak now if you uh yeah, I'm just allowing people to unmute so that they can ask their question directly if they have anything before we close out. Otherwise, we've had a very interesting session today. I learned a lot myself. Even though I'm a nutritionist, I've not worked so much in infant and young child feeding. I've worked mostly in micronutrient programs. So I've really learned a lot today around the gaps in policies, and implementation, all that. One thing I would have loved for us to talk about, I know that Valerie wanted to understand wet nursing in other contexts. I know I heard at a point, I'm not sure of this information, we need to check, that there was someone who was trying to set up like a breast milk bank in Nigeria. I don't have the full information, but definitely if we find it, if we try to send communication about this, we could target to maybe the conversation. But otherwise, it's been amazing. I would like to use this opportunity to thank all our exceptional speakers. It's been a lot of learning curve for all of us to do this, despite the language barriers, despite we were able to have a very amazing session and that everybody was included in a way. Of course, we do acknowledge some of the technology itch. Well, we'll develop as we work through it. But it was really a great attempt. And I'm so thankful for every one of us that we made this happen. To all our participants for staying on till this time. I'm impressed that the number did not really reduce. Maybe two or three people dropped from the beginning. Despite the long, it shows that your commitment to this session. So once again, thank you very much and see you on our next one in the next quarter. Hopefully, World Food Day in October. See you. Au revoir.
Wow.
Au revoir.
Au
And what's the
revoir.
word in Kenya now?
Wow.
I know Caribou. I don't know
Au
what bye
revoir.
bye is again.
Uh,
What's bye bye? Remind me my Swahili.
Bye. Good,
Kwaheri.
good,
Yeah.
Merci.
Really.
good. À
Okay.
très
Thank you.
bientôt.
Merci beaucoup.
Merci.
Merci beaucoup.
Merci.
Yeah.
Bravo.
Yeah. All right. Okay. Thank you.
Bye.
Bye. Enjoy
Bye.
your evening.
Bye. Bye.
Hey.
So, bye bye. I'll come to Morocco one of these days.